Hi, everyone. So imagine you're at a routine doctor's visit and they give you the scariest diagnosis that you could imagine. Think for a second about what that might be. Well, for most Americans age 50 and older, the answer to this question is not cancer, is not blindness, is not deafness, is Alzheimer's disease. And Alzheimer's is so feared because it causes brain degeneration that can cause memory loss, mobility limitations, severe mood swings, which all too often lead to the person affected slowly losing their independence and at times their sense of personal identity. Unfortunately, Alzheimer's impacts over 6 million Americans and has no survivors, as everyone diagnosed with Alzheimer's either dies with it or dies of it. Recently, as many of you may have heard in the news, the Food and Drug Administration, or FDA, approved the first drug that actually targets the ways in which Alzheimer's impacts our brain and does not just treat its symptoms. This is a hugely important breakthrough for Alzheimer's research, and this offers tons of hope and opportunity for patients, especially those in the early disease stages, to prolong the progression of their disease, potentially giving them more time. However, this drug is currently priced at $56,000 per year and is administered over longer than a year. And insurers, including Medicare, which most Alzheimer's patients are covered by, have yet to make decisions about how it will be covered. And fully covering this drug, obviously, at its high price would create a huge financial strain on Medicare, and private insurers also have yet to issue decisions on this. Centers for Medicare and Medicaid Services, or CMS, is actually addressing this by conducting a national coverage analysis, which is where they are looking at all the data available to understand how it may be covered with the national coverage determination, which is where Medicare issues a decision to cover a drug or treatment nationally as opposed to leaving it up to local Medicare contractors. And this is hugely important because it would ensure consistent coverage for all Medicare beneficiaries, regardless of geographic region, helping to promote health equity. On the other hand, if the national decision is to not cover this drug, it will pose a huge health equity issue, as only those that can afford the huge out-of-pocket costs of this drug would be able to receive it. And this isn't just about this one drug that was recently approved. It's about all drugs of this class that will continue to improve and be approved later down the pipeline. So my research this summer, we convened a group of stakeholders to discuss opportunities for developing more evidence to inform these payment decisions of these new drugs. Because this is such a prevalent disease and it impacts individuals so differently, insurers, providers, and regulators must collaborate some of their previously siloed data and their perspectives to really ensure that all patients are equitably receiving the right treatment at the right time. This treatment that has currently been approved is most definitely not a cure, but it's a step in the direction of one. And coverage must consider the potential impacts and future hope that this can give to patients. Although a lot of aspects of Alzheimer's and the future of this approval are unclear, there is one thing that is crystal clear. Alzheimer's patients deserve access to treatments that give them hope for the future and more time with their families to live life to the fullest. Thank you.